Representative Carney, and I especially want to thank Planned Parenthood CEO Stephanie Kight and our Ohio women and former Planned Parenthood patient Becky and also Emily. Very moving words, and it's very important for us to hear from you, the experts, the patients, the real Ohio women who these provisions really are attacking your basic right to health care. Again, we have heard from the experts both here today and last week when we conducted an informal hearing. There were no hearings about many of these provisions that were shoved into the budget at the 11th hour in the dark of night with no opportunity for public input. Last week, we held an informal hearing where we invited experts to come testify, not legislators, not the governor, who, as John laid out, does not have a medical degree, but actual doctor, an actual legal expert, Ohio women, women's health advocates, social workers. We had a group in to tell us about these harmful provisions that were put into the budget. We heard about how dangerous these provisions are for women's health care. We heard about how costly these provisions will be for Ohio women and how they will increase the cost of health care in the state of Ohio. We heard about the costly litigation that will occur because many of these provisions are likely unconstitutional and will be battled in the courts in the weeks and months to come, costing the state thousands and thousands of dollars to defend. We heard about rape survivors and the effect that these provisions will have on victims of sexual assaults and rapes. And we heard about the forcing medical procedures on women, invasive medical procedures, and the trauma that could cause, and the attack, again, on their basic right to say no to certain healthcare procedures. So today, Representative Carney and I and our colleagues on our side of the aisle are announcing legislation to repeal these measures that were put into the budget. The measure that would defund Planned Parenthood in the state of Ohio. The measure that would force women to undergo medically unnecessary ultrasounds. The provisions requiring clinics to have transfer agreements, and then requiring that those transfer agreements cannot be with public hospitals. The gag order. We will repeal the gag order that was placed on rape crisis counselors in their consultation with rape victims and other survivors of sexual assaults. We will not be silenced. And these provisions are very harmful to Ohio women, as we've heard today and last week. And we announced today that we will introduce legislation to repeal them.